Hello, my name is Maria Beebe, and today we'll be talking about telemedicine, the new evolution of healthcare. Telemedicine is much more accessible, cost efficient, and it also increases the patient's engagement. This is very useful and is also portable. It can be accessed anywhere as needed be. Patients can consult physicians at their comfort of their home. And overall, from faraway locations and being able to have difficulties accessing physicians from rural areas, this will be a much more portable and much more cost efficient, as well as overall a better way to access the physician and help needed by the person. An agenda that we'll be doing today is we'll be talking about telemedicine as well as telecardiology. We'll be talking about reasons for telemedicine, what we know about telemedicine, how many people use telemedicine, cost savings from telemedicine, patients in rural areas, telemedicine challenges, and the rebuttal with solution of that challenge. So, telemedicine and telecardiology go in hand to hand very well. So, in telecardiology, ECGs or electrocardiographs can be transmitted by using telephone and wireless. William Eisenthoven, the inventor of ECG, actually did tests through transmission of ECG via telephone lines. Overall, in 1906, Eisenthoven came up with a way to transmit data from a hospital directly to his lab, and in the general care for delivery, remotely treating ventricular fibrillation, Medphone cooperation in 1989. Basically, telemedicine and what we've been learning about cardiology goes in hand to hand very well, and telemedicine can be used for many things. So, reasons for telemedicine. One reason telemedicine is so important and so amazing is during the coronavirus, it is better accessible to healthcare. It is also a Telemedicine has begun over 40 years ago. Advances in technology increased abilities for patients, especially in the 20% of Americans living in rural areas. Rural areas is basically something telemedicine really focuses on, and it will help access the healthcare more efficiently. Um, this is coronavirus information. As for McKnight's Senior Living, it also increases the health care access in senior living communities. It will boost convenience and also have more disease management in different hospitalizations and have higher rates and lower risks for adults in senior housing communities. And as for health tech, it helps conserve supplies and bed space. It will be much more reduced in supplies for hospital beds and keeping low risk patients at home. And overall, it will keep everything underwhelmed. So, what we know about telemedicine? We know that telemedicine is obviously growing as technology grows. We can also infer that half of all the US hospitals currently have telemedicine programs. the global telemedicine communities in the market into the hardware, software, and services are valued over 17.8 billion in 2014 and is predicted to grow at a compound annual growth rate of 18% point 4 from 2004 to 2020.2. This is absolutely amazing because we can see that since technology is growing, we can see that telemedicine is also evolving with technology. And as the new programs are able to progress, we are able to see the different growths and different ways that telemedicine grows as it continues. Oh yeah, there's also about 800,000 online consultations in the US in 2015.3, which is amazing. Um, about 90% of the surveys and healthcare executives report in their organizations also have begun in developing or implementing telemedicine programs. So as the future continues and as we move on, we'll see more telemedicine in the future. How many people actually use telemedicine? This is an astonishing number of 7 million people in 2018, and it is up from less than 350,000 in 2013. Already 29 states in the US have telemedicine services. Cost savings for telemedicine. US employers have been saving 6 billion per year by providing telemedicine technologies to their employees. The Genster Health Plan study found that this implementation of the telemedicine program generated about 11% in cost savings during the study period. This led to an estimated return of an investment about $3.30 in cost servings for every $1 spent on the program implementation. We can see that the cost efficiency is absolutely amazing, and this will overall be more useful than just having a physical contact. It is much safer. For instance, the coronavirus and everything. As I've mentioned before, patients in rural areas are also a factor into why telemedicine is so important. About 20% of Americans live in rural areas, and they absolutely they are without easy access to primary care for specialist medical services. And as time continues, in one survey, it was found that 44.3% of healthcare system respondents said that patient care gaps due to community and remoteness were the main reason for adopting telemedicine. So in this slide, I can summarize that telemedicine has an amazing amount of people that use it. It is very cost efficient, and it is able to help the people um, with rural areas in rural areas and how help them get the medicine or the medication or the or the overall physician consultation that they need. So a little bit more is a problem in telemedicine that I believe that was very important to mention is that there's an inadequate telemedicine partially laws in Medicare reimbursements are among the top challenges faced by telemedicine programs. According to the survey of Reach Health, 40% of respondents said that partially law growth under rest and 30% said it was partially undressed. So basically, some problems that the patients have are mostly unaddressed because of the fact that the physician and the patient are not in the same room and it is much more impersonal. And yeah, this has become a very large problem that needed a solution. So, telemedicine visits at an average compound annual growth rate of 52% per year. Solutions I've come up with were improving patient outcomes, providing remote or rural patients access to specialists, increasing patient engagement and satisfaction by being able to have longer periods of listening to what the patient is actually feeling, and even having more time, having a 24/7 access to specialists, and this will definitely be very helpful. Also, reducing cost for care delivery, improving specialist efficiency, reducing unnecessary emergency department visits. There's many things that can be done in order to have more accuracy in addressing what the patient exactly needs, and that's by providing more time with them or providing more questions that they could answer, or they could email or whatever they need. These are my resources. Thank you.